Hi everybody, how are you doing? My name is Michelle Raxi. Welcome to my YouTube channel. Kindly subscribe and turn on the notification bell. Okay, today I'm going to talk about pneumonia. I just realized that many people are having misconceptions about pneumonia. People believe that pneumonia is caused by a cold environment. Let's say, for instance, a child is not wearing a pullover during winter or during a cold season. So you think that the child is gonna get pneumonia because of that. No, that is just a misconception. For starters, let's define pneumonia. Pneumonia is an infection that inflames the air sac in both or one of the lungs. So this means that the air sacs are filled with fluid, making it difficult to breathe, and when you cough, you're coughing with phlegm or pus, and you're having fever and chills. So we are going to talk about the causes of pneumonia. Pneumonia is actually caused by a bacteria, a virus, or a fungi. The most common causes of pneumonia are bacteria and viruses. And the pneumonia that is caused by a fungi is when fungi are found in the soil or bird droppings. So let's say, for instance, you inhale those fungi in the soil, you're gonna get a fungal pneumonia caused by the fungal, for lack of better words. So there are different types of pneumonia. There is hospital-acquired pneumonia, that is the pneumonia that you get in the hospital. Especially these people who are using ventilators in the hospital. They have stayed in the hospital for so long. They are actually at high risk of getting a hospital-acquired pneumonia through the ventilators. And others can get from the hospital because they may be sharing a room with other people who already are infected with pneumonia. And pneumonia can be passed through droplets. It can be passed from one person through to another. It's really contagious. Yes, it is. It is contagious. So when you get pneumonia from a hospital, that means that it's gonna take long to heal because it is actually antibiotic resistance. Because people who are catching it, they're already sick and their immune system is already weakened. So that it's gonna take long to heal. Like, you know what I mean? Another cause of pneumonia is community-acquired pneumonia. That is the one that you get outside the hospital setup. And this can be bacterial or fungi. Yeah. And there is aspiration pneumonia. This one you can get it when you, let's say, accidentally a food slips into your lung or some fluid, you're drinking something and it slips into your lungs, you're gonna get aspiration pneumonia. Yeah. And there is a high risk group for catching pneumonia. Let's say if you are older than 65, you are at high risk of getting pneumonia, and children below the age of 2 years, and people who are having an underlying condition, let's say, for instance, cancer. When you undergo chemotherapy and you are using those drugs that suppress your immune system, you are likely to get pneumonia. What is the other risk factor of pneumonia? Let me think. I think that's all among other causes. And also, even if you're healthy, there is a high chance of you getting pneumonia. Sometimes your immune system can just be suppressed. Maybe you have a cold or flu, just the normal cold or flu. That can really suppress your immune system, making you to catch pneumonia. With all these few things that I've talked about, I really think I made it clear for you about the causes of pneumonia, and you guys are okay with that. If you have any questions, leave it down at the description box. Thank you for listening. See you in my next video. Bye, and please kindly subscribe. Thank you guys. Thank you.